This is the graveyard shift, and you'll notice there's a pecking order in medicine. All right? You have the brain doctors, like Dr. Webb, right on top. Then you have all the other specialities in infection and medicine, pediatricians, and right at the bottom, last on your list, to put you asleep, will be the carpenters. All right? So I'm a carpenter now, and I'm going to share with you some science tonight. Now, we all know the saying, healthy body, healthy. All right, so now, if I was an enemy of the mind, I would attack every single avenue, including the body. And I'm going to shock you tonight because many people aren't aware, a few people in the scientific world, but many people aren't aware that we are heading for the perfect storm. And I'm going to just give you a little bit of information tonight as we close this session. Now, the center of the universe is the hip joint, if you didn't know. And if you've ever known someone who's had a dislocated hip before, we do a lot of hip replacements in orthopedics, and one of the biggest disasters next to infection is a dislocation. All right? Don't know if you know this story where Jacob's hip was put out of joint. Now, I've seen people with their hips out of joint, and they have the white knuckle death grip on the bed. There's no ways that anyone can continue wrestling. Trust me. This man had his priorities straight. He wanted a blessing more than anything else, despite the pain he was in. And I want you to understand that we're heading into a desperate storm, and we need to have those priorities. And we need to make those little decisions now which can change your life. I deal with pain, and unfortunately, like Malusi, my whole career is built around other people's pain. Okay? When we're in heaven one day, I'm going to be out of business and I'm going to retire. But I can tell you now that each person that comes to see me, I see a lot of rugby players and they say, I abused my body when I was younger, doc, and now I'm paying the price. If I only knew. The thing is now, a lot of people don't realize that the choices you make now and every day is going to determine where you're going to be in 5, 10, and 15 years' time and how much pain you're going to do. And medicine can't take away all your pain. All right. So let's jump right into it. Let's talk about arthritis. We're going to talk about joints, and we're going to talk about bone, and then vitamin D, those three little sections. So what is arthritis? We're talking about wear and tear arthritis. There's just a few statistics there. About a third of Americans, because that's where we get most of our statistics from, have painful joints, arthritis. And many of them significant and on treatment. Not all those treatments are healthy for you. You heard Bruce, what he said this morning, that those medications can affect your heart and your brain and a lot of things. So chronic pain, medicine with side effects. It's very difficult to choose between the two. So this is what arthritis looks like. We're going to look at the bottom side of the hip, for example. The normal hip at the top there. For those of you like me who weren't vegetarians all their life, so the leg of lamb, you've got this beautiful white surface. Now, if you take that surface away, then you have, I think it's going to keep happening. I don't know why it keeps coming up. Someone, okay, let's try once more. Okay, if it goes again, I'll just have to go and look for Wi-Fi. So you've got about 5 millimeters of cartilage. It's like the tread of a tire. All right? When that wears down, you've got nothing left. You've got bone on bone. And that's what people say, bone on bone arthritis. And that is painful. And the only way you can really alleviate that is with a joint replacement, which is never as good as your natural joint. So once it's there for keeps. So that's what arthritis looks like, just to give you an idea. When you look under a microscope, you see that beautiful normal surface at the top. It's a low friction system. But as soon as you lose that surface, you get down to the bone, it's a high friction system. That's what causes pain. That friction, you get water on the knee and it gives you lots of pain. That's a picture of a normal joint. You can see the whole patch pulled out of there. It looks like that knee hit a pothole. Piece of rubber pulled right out. The bottom knee even worse. Every time a patient gets up, they've got pain. Long distances, after 5 minutes they get pain. It's really disabling. And many people come in there and they're depressed. Some people even say they're suicidal. The pain can get so controlling over your whole life. And that's the treatment for it. You can see the bone on bone there. There's no joint space. And we put in artificial joints. Yes, they help, but 1% of those patients get complications. I've seen people in the past that have got complications like infections or dislocations and end up with amputations. Infections, diseases now. There are very little drugs now that can take out the superbugs. We're getting superbugs that are getting stronger, and the scientists can't keep up. In a few years' time, that's going to be our biggest problem in orthopedics, is that we don't have the cannons to shoot the big bugs, like the MRSA and you've heard of the superbugs. So we're heading for a storm. You'll find all kinds of adverts now for arthritis, glucosamine, chondroitin, all the fancy tablets and the silicone injections. It's a big industry, billions and billions of dollars throughout the world just on arthritis. This was alarming, and I was at a conference the last 2 days in Cape Town, and I was speaking to one of my colleagues from London, and he had a few other graphs, which I didn't get from him yet, but 2016, just in the States, 750,000 knee replacements. Now, we're not talking about the neck fusions and the hip replacements and the shoulder. This is just looking at knees. 750,000, all right? In 14 years' time, when we get to 2030, what is that graph doing? Almost 3 million knee replacements. Can you imagine? So what is happening? The scientific world said, oh, wow, the physicians are doing really well because we are living longer, and that's why we're all getting arthritis. But then yesterday I saw a graph. The arthritis spike is not at the 60, 70, 80-year-old patients. 40 to 50-year-olds. They're getting arthritis younger. So it's not because we're living longer. So there's something we are doing wrong in our lifestyle. Isn't that right? We are heading for the perfect storm because we don't have the finances to do it. You hear the problems in South Africa. I've just come back from a month in the States. The problems are just as big there. The governments are tightening up. We don't have the funds to cope with the next 14 years. And this is just orthopedics. Never mind all the heart and the brain issues that we're escalating with. I'm not here to scare you, but I want you guys to understand where we're heading. And it's lifestyle. There's no other explanation. So I'm going to go to this slide because a very interesting slide. In the 1800s, sorry, it's cut off there a little bit. In the 1800s, there wasn't a lot of arthritis in Africa, okay? The Western countries had their arthritic knees and hips. Then, when they had a look at it again, the incidence of arthritis in Africa and Asia, which was so-called third world countries, the arthritis is now coming up to the same incidence as the Western world. And the people are saying, why? More than 65%, over 65 years, more than 50% of people are having arthritis, and many of them are having joint replacements. Never mind the fusions, all that. I'm just talking about orthopedics, but you must remember, I'm just showing you a small part of medicine. Everything else is escalating too. Why is it that Africa now has got the Western diseases? It's because of the factors we're going to discuss now, which is the easy life. It's lifestyle factors. So just a quick physiology session. I want them to understand that I know some medicine and I remember something from medical school. The top left over there is a joint, and you see the bone looks like the spongy part. Let me just get a pointer. And then the yellow surface over there, that area over there, those two little balloons, that's a joint capsule. So the joint is separated from the muscles, the bone, the muscles and the blood vessels and so on. But the blood supply doesn't go right in there. The blood supply comes and forms, there you can see it, there's a single layer of red cells that comes through and then supplies the synovial fluid, which then goes to the articular surface called chondrocytes, which is what we're trying to preserve so we don't get arthritis and need surgery. So what happens is there's certain conditions where you get these macromolecules coming into your blood, and it's normally food products. And they've done studies. We heard from some of the lectures before, anything that causes an acid environment increases the perfusion. And the perfusion, if this layer is damaged, you get all kinds of other molecules coming in here, and that creates an acid environment for your chondrocytes, or the cells that form your joint, and that's why they break down. So a lot of it is related to the diets that we eat. And the pro-inflammatory diets will be the animal products, and I come from Hoedspruit. There's hunting territory. We have biltong this big over there. My wife comes from Standerton. And when I went to visit these crazy Afrikaans people, they had just bought a whole sheep. They cut the sheep up and filled 2 freezer full. I couldn't understand it, but it was good, wholesome meat. That's what the background is that we come from. Once we started understanding this, and Adele also had an incident where we met in medical school, and she got a virus which created an inflammatory condition of her joints. And nothing would take away those joints. Similar to rheumatoid. Rheumatoid, you know, with the inflammatory. We're talking about wear and tear arthritis, but you get the other types, the autoimmune arthritis. The only thing that cured her was changing the diet. Dairy and meat. And unfortunately for me, I had to give up my biltong. But now, as I've been studying, and I've been seeing patient after patient coming through my door, hip replacement after knee replacement, I've realized we are heading for a storm. So what happens is when you get this inflammatory reaction over here, it actually destroys and delaminates that articular surface. So where people were getting arthritis in the 70s and 80s before, we're seeing people coming into our clinic, 40s and 50s. 4 days ago, we did a knee replacement on a 23-year-old. I mean, it's ridiculous. It's absolutely ridiculous. The other thing is hydration. You can see over there, because there's no blood supply, there's a big distance there between your articular surface over there and your blood. And if you dehydrate yourself, you don't have enough fluid there. Now, unfortunately, the joints we are on the bottom end of the pecking order. Your vital organs are your brain, your lungs, your heart. So if you're dehydrating yourself, you're not drinking your 6 to 8 glasses of water a day, your joints are going to suffer. Because if you don't have the fluid around the joints, you can't get your glucose and oxygen to your articular surface, and you can't get rid of the waste products. Also creates an acid environment. You see how important water is for your joints. It's vitally important. Now, this is a chemical reaction that happens there, and I only put this up to confuse you and myself. But essentially, there are some clever microbiologists and scientists and biochemical guys out there, and they can prove all of this that we're telling you scientifically. And it's fascinating to see. I'll never try and memorize this, but the point is that God created us fearfully and wonderfully. And the scientists can prove to you that the original Eden diet is best for your joints and your brain. I'm always teasing Bruce because we work together, and he's the brains and I'm the bones. And I make no bones about it. But the point is that he keeps reminding me of the physiology and of the brain and what I must do and so on. And I keep reminding him that all those things that he's talking to me about is so important for the brain is the same for the bones. The same things that affect your brain affect your bones. It's fascinating. All right, so we're just going to go through the leaky gut. There's a lot of scientific evidence to show this. One other thing, exercise. Okay? Now, exercise is emerging as the single most important lifestyle factor. I think Bruce was explaining to me. Now, we're going to do a little experiment now, okay? Bruce, maybe you can time it for us. I want all of you to check your pulse. You've had a little bit of exercise. I've just given you time to relax. Now, Bruce is going to say start, and then 6 seconds later, he's going to tell you to stop. And I want you just to count your pulse rate, okay? You all ready? Bruce, you're going to say start and stop for us.
3, 2, 1, start. Stop.
Okay. So who had below 8? All right. Who was above 8 or 8 or above? Okay. That means if you are 8 and above, your pulse rate, your resting pulse rate per minute is 80 plus. And what the scientists have shown is if you exercise, your pulse rate comes down. Mine was 8.2, but I'm standing in front here. It's normally around 6 or 5. But the point is, you times that by 10, so you get your pulse rate per minute. If it's 80 plus, you're at a higher risk for osteoporosis, for hip fractures. Double. Exercise is so important now. We're going to talk about osteoporosis just now. But not just for osteoporosis, but also for weight control and perfusion to your joints. The blood's not going to your articular surface. Remember that picture just now? So we said we need healthy diet to keep the pH neutral. We need fluid, water, to keep the lubrication so we can get transfer of oxygen and glucose. But then we need movement to circulate the fluid. And it's very important. They've shown with multiple studies that exercise protects your joint. Now, I like this little thing because, when you speak to doctors, a lot of them don't exercise like they should. And they think they've got youth on their side. And then one day when they wake up, they've been chasing the clock, running between hospitals and ward rounds. They suddenly realize it's too late. Their schedule didn't allow it. And if you read what this guy says, the doctor says to this guy very bluntly, what fits your busy schedule better? Exercising 1 hour a day or being dead for 24 hours a day? And that's really what it boils down to. It's said tongue in cheek. But if you don't make that investment now, while you can, your joints will pack up, your heart will get to a point where you cannot make that investment at all. And you're going to cut off 15 to 20 years of your life and the quality. All right, so we talked a little about arthritis. We're going to talk about osteoporosis now. Osteoporosis is an investment you make when you're young. If you're a lady and you're over 30, I'm not going to ask you to put your hands up this time. If you're a lady and you're over the age of 30, you cannot significantly make any more investments into your bone bank. All right? Just telling you bluntly now. You can still make a difference and reduce the consequences of your osteoporosis that you're going to have in the future. But it's very important that we understand that your bone bank gets filled up in the first 20, 30 years of your life, especially the ladies. They don't have testosterone, which is bone protecting. And after 30, if you haven't done all the things we're going to discuss now, you've got to make some really serious decisions about the future. In orthopedics, my spine colleagues, most of the trauma work in orthopedics is hip fractures, falling, breaking the wrist, insufficiency fractures when the bone is weaker than it should have been. People just twist their ankle, it snaps right off. You see some of the older ladies starting to bend and walk like this, because the little vertebral bodies are cracking in the front. See a picture just now, and they're shorter. So it's a very big problem. Now, if you look at what osteoporosis looks like, so the bone looks like a sponge if you look into it, and those spaces get bigger and bigger the greater your osteoporosis is. And if you look at these two pictures, you can see there that's more like normal bone, and if you look at this side, you see the big holes developing. So if you had to drop that on the floor, that would crack much quicker than the other side. I heard a good analogy from one of my colleagues. He says that, when you're coming past Umhlanga there, they're busy building the roads bigger and so on. Okay? Now, if you go out to a farm next to that area, it's a little dirt road, just a half a mile apart. The traffic that you put through the roads is going to determine how much that road is going to be built up by the government. If you're not putting exercise through your body's not going to waste resources and energy to put a highway through a little farm area. If you don't exercise, your body's not going to waste resources to build good quality bone for the future. So exercise creates electricity in your bone to generate more investment of minerals, phosphate, calcium, and so on. So remember that. It's very important, exercise. And what Adele said earlier, walking is very good exercise. A lot of people can't run. But walking, get your pulse rate up. If you do that 20 minutes a day, at least 5 times a week, 4 or 5 times a week, you're doing really good exercise for loading your bone to prevent osteoporosis. In America, there's more than 10 million people with osteoporosis. 84 million people with osteopenia. Now, osteopenia means you're heading in that direction. And everyone with osteopenia will become osteoporotic within a few short years if they don't turn the boat around. And it's crazy statistics, because if you see what's coming in the next 14 years in osteoporosis, very similar to what we saw with arthritis. There's big disasters coming. We don't have the finances to be able to treat everyone with a hip fracture. And one of the old orthopedic surgeons, he's a father of orthopedics, John Charnley, he says, people come into the world through the pelvis and they leave the world through the hip. The mortality rate for a hip fracture is 50% at 1 year with surgical treatment. We're getting to a point, not too distant future, just like other parts of Africa, where we're not going to be able to afford to treat patients that come with hip fractures, not everyone. And we have to make that investment now. And the generation, our children, and we need to teach them these things too, so that they don't end up with these problems. So there's a lot of causes for that. We're just going to go through a few. They've looked at statistics about the mortalities at 1 year and so on. But I'm just going to show you. Many people say that, if you look at the top left corner there, they come in, they say, Doc, I fell and broke my hip. But many times it breaks, and because it's broken, they fall. It's the osteoporosis, and it breaks, and then they fall because it broke. And people think, I fell and broke my hip. But actually, your bones were so soft, it couldn't carry and it broke. Do you understand how it works? Just to show you the point. And that's what happens in the spine as well. You get two parts of the spine, the front column, the big bone, and then the back column. And the front column collapses. The back doesn't collapse because it doesn't have that huge bony surface, and that's why it bends forward. They've got all kinds of fancy devices now where they stick needles in the back and pump it up full of bone cement. It's just like normal concrete. It gets hard. And trying to build up in place of bone. But that's a temporary fix. Why do you want to put yourself through surgery? I've seen patients where that cement has leaked out and burnt a cord with all the nerves in the back. Ended up with a weak leg, that type of thing. That's why I don't do spinal surgery. But it's a very significant complication in the spine world. You can see how people go more and more bent. And we all know, I had a little granny as well, who, by the age of 90, she was really bent over, and she struggled to actually look up when she wanted to look at the birds. So it's a significant problem. There's different ways of diagnosing that. I'm not going to bother you with that right now. Very fancy technology. And it'll come back and it'll put it on a graph for you. The red is osteoporosis. This is osteopenia. And everyone goes from osteopenia to osteoporosis unless you dramatically make lifestyle changes there. People in the green, they're good. They're good to go. The chances of them having an insufficiency fracture or a hip fracture is very low. So as a lady after the age of 40, you should maybe get a scan done, and every few years, depending on the results, so that you know where you're heading and if what you're doing is making a difference. Don't just leave it to chance. Check it. It's one of the few things you must check. All right. Other causes for osteoporosis. I'm just going to go through a few with you. There's some interesting ones. Sugar. Why would sugar give you osteoporosis? And one of the articles I was reading recently said it's the leading cause in the Western world. Now, I was discussing with Adele and Bruce the article that came out from the American Agriculture Department. They said in the 1800s, the average American was 4 pounds, I think, Bruce? 4 pounds of sugar per annum per person. Who wants to take a guess what the average sugar intake is now in America per person per annum? From 4 pounds per annum, per year. Sorry? From 4 to 20, I've got 20, I've got 40 on this side. Anyone else? 100 there, yes, we're getting better, closer, warmer. 150 to 170 pounds in the last 200 years. I mean, it's in every sauce, it's in every sugar. A friend of mine at the conference yesterday, he works very closely with us in theater. I said to him, Ant, I call him Lieutenant. I said, Lieutenant, did you have one of those Fantas? Because I used to tease him. He used to drink a Fanta. We used to get cool drinks for free in theater, which is the worst thing to do. Fanta, I don't know if you all got that little picture with the amounts of sugar in each drink. Fanta orange has got more sugar than Coke. So what I did is, he was sitting there drinking his Fanta. I took a glass, and I took the sugar bowl from the coffee department, and I started counting the spoons in front of me. And I filled the glass halfway up. So I put in 14 teaspoons. I think it's a bit more, but I think about 14 teaspoons I put in, and I said, put it next to his Fanta orange. I said, Lieutenant, that's what you're drinking in that one can. And he hasn't touched it since. It's crazy to realize how much sugar there is amongst people in the Western world. Tomato sauce, this, that. If you're going to have a milk tart, just cut it down. It's the awareness. I'm not telling you now that I'm a saint and I've cut out everything that's bad for me. When we have something now, we'll have a small amount and less frequently because I'm aware of what this is doing to me. And the way it works is it increases your urine calcium by 124%. So when you're taking a high-dose sugar, for the next few hours, your kidneys is actually excreting, it's the way the pumps work in the nephron, it's excreting calcium. And calcium is your currency for your bone. So that's the problem with that. What about salt? A little bit of salt is not bad for you, especially if you get up and you're very dizzy for your blood pressure. But the excess salt that's in all the food now, and some people just love salt, it also increases your urinary calcium because it competes, sodium competes with calcium. And sodium is always maintained for blood pressure in your nephron. That's the way we were made. So if you have excess salt, you also lose calcium. All right, caffeine. One of the greatest drugs, and the currency that's generated through caffeine is bigger than, I think it's one of the biggest businesses now. One of my friends is an expert with coffee, and they were telling me about the billions and billions of dollars that this business is worth. I've got an anesthetist that drinks 5 cups of coffee a day. A lady. White lady, blonde, caffeine. It's the worst combination that you can have for osteoporosis. And she's a doctor. She puts our patients to sleep that we're fixing with their hip replacements after they've fractured their hip. What happens is with every cup of coffee that you take, for the next 3 hours, you're in a negative balance calcium. So if you're having 5 cups of coffee a day, you are going to be osteoporotic within a few short years because your calcium balance, you just can't keep up. 1.5 cups of coffee puts you at 33% higher risk for a hip fracture later on in life. That's one flip out of every 3 flips of the coin. Significant. And that's just 1.5 cups. Caffeine is not good for your bones. What about alcohol? Alcohol works slightly differently. Alcohol is cytotoxic. And what it does is the precursors for your osteoblasts. Remember we had the chondrocytes that line the joint? You have the osteoblasts and the bone cells that make up the inside of your bone, not the joint. And it's very sad, but some of the research that's coming out now is scary. You see these young ladies in their teenage years and early 20s, university, having a drink. They've shown that those osteoblasts are so sensitive to alcohol that those ladies are going to be severely osteoporotic one day. And the problem is it's not reversible. It's not reversible. It's very, very scary to read those scientific articles because you see our young people that are drinking, and they say, no, I'm not getting drunk. But what they don't realize, what they're doing is they're poisoning themselves now, and in future, they're going to pay the price, unfortunately. Nicotine, tobacco works like a hormone. It does the opposite to vitamin D, and it causes osteoporosis. This is all well documented. We talked about exercise just now. Critical to load that bone. Walking is one of the best, or any form of impact exercise. Riding a bike is good exercise for the rest of your system, but it's not going to load your bone as well, as much. And you need that resistance to strengthen your bone. Now, I have a confession to make because as doctors, we talked a lot about calcium intake. Let me go to the next slide. And we used to teach people, drink milk, cheese, dairy, yogurt. Build your bones. You need that high calcium intake. Yes, it has a lot of calcium, but unfortunately, just like the previous slide, animal products, as well as dairy, is high in sulfate and phosphate content. Now, when it gets into the system, it goes through your gastrointestinal tract and it gets converted to sulfuric and phosphoric acid. So what does your body do? You don't want an acid environment in your body. So it needs to draw out a buffer. And what is the buffer for your body? It's the same banknotes. Your currency for your bone is calcium. So you have to buffer. Now, yes, you're putting a lot of calcium in, but you're taking calcium out of your bone. The absorption of the calcium that you're putting in is not very good. A lot of it goes out again because the calcium in dairy, only about 20% gets absorbed. We've got a world expert here, Michiel still here. He talked about soya. I don't know if anyone went to his workshop. The calcium in soya, because the protein is different, there's a higher percentage. About 10 to 15% more calcium out of those products are getting absorbed. So it is a better product for combating osteoporosis. And it also doesn't have the high sulfate and phosphorus. It hasn't got the same type of amino acid that gets changed to acid environment. So that's just a very interesting bit of information. A lot of doctors don't always know this, though. But there are studies to prove it. I'm not just sucking up some physiology here. There's studies in Europe where they, and in Norway, they absolutely document everything. If you come in with a wind or a cold or something, gets documented. So they took records back to 50 years, 40, 50 years, and they found that ladies in their first 20 years, and in those areas there's a lot of dairy, who used dairy were at 247% higher risk of insufficiency fractures when they, between the age of 50 and 70 years old. That's huge. You can't even comprehend it. So there are studies that show that if you're going to have dairy, keep it to a minimum, rather have calcium in other forms to prevent osteoporosis. What about stress? None of us know what stress is. We can skip this one, eh? Look at this graph down here. We are living in probably one of the most stressful generations that there is. Okay? The stress of insecurity. If you look at how many people have died in wars through 6,000 years of world history, in the last 200 years, there's been more than the 6,000 before. The stress of wars, the stress of economics, it's gotten so bad. And we don't have to go and belabor that point now. But stress has been shown to cause osteoporosis because what it does is it pushes up your stress hormones and a number of other physiological factors that Bruce tells me about. But I kind of, after the third point, he gets so sophisticated that I just can't keep up. But I believe him. Stress causes osteoporosis. All the studies show that. Okay? So you have to be active in reducing your stress. And it takes a lot of brave people to do that, to draw boundaries and healthy boundaries. And especially I've noticed in church environments, in any religious environment. I was speaking to a professor yesterday, he's a Muslim, and we were talking about this type of thing. People especially who have very strong convictions about a religion will want to do everything to that point of even compromising on their health. God doesn't expect you to compromise on your health in serving Him. He wants you to have a healthy balance. Okay? So just keep that in mind. You set healthy boundaries for yourself. Don't compromise your health for anything. Proverbs says, "A merry heart doeth good like a medicine, but a broken spirit drieth the bones." It's not just poetic language. Drieth the bones is osteoporosis. Okay? And there are plenty of scientific articles to show that stress causes osteoporosis. Who said that book wasn't scientific? All right. I'm going to quickly go through a few things on vitamin D. Vitamin D, there's various sources of vitamin D. The sun is the best form of vitamin D. It's got the advantage in that it goes through your skin, changes cholesterol. We'll go to the next slide. Into vitamin D, it gets activated in the liver and the kidney, and then that builds the bone with the calcium. Now, you can take it in with certain foods, but it is very low in certain foods. Okay, it's really too low, and people try and fortify certain foods with vitamin D, or take it in oral form. So there are people who stay out of the sun for various reasons. And if they're not taking a vitamin D, they're at a risk of a lot of medical complications, including osteoporosis. I separated this from osteoporosis because there's other conditions that vitamin D affect. So we're going to have a look at that first. Now, vitamin D can decrease the incidence of flu. Why does it do that? We talked about influenza as one of the top 4 or 5 causes. It was the fourth one. So you had influenza, you had TB, we're going to discuss that now, and pneumonia. It's interesting that it's in my slides too, you'll see now. Now, how does vitamin D prevent you getting flu in many cases? And also, if you do get flu and you're on a good vitamin D dose, your recovery time is going to be much quicker. It's because it affects the immunity of your body. It affects the immunity of your body. And what they recommend is that you check your vitamin D. Now, it's unlikely we're going to have vitamin D deficiency in sunny South Africa, isn't it? This is more Europe, North America, England. Oh, one of the slides I put up yesterday of England was all muddy and rainy, and they say that's what they've just come back from, to come and lecture here in Cape Town where I was. They have vitamin D deficiency, but we as South Africans don't have vitamin D deficiency. Is that true? Bruce and I check all our orthopedic patients coming through the clinic. We work at the Gateway Private Hospital, so it's the socio-economically strong group of people that come in there. 8 out of 10 patients, especially the women, are vitamin D deficient. The range in the lab is different to other places. We've got between 30 and 100. Some of our patients are coming in below 10 in sunny South Africa. Why is that? And Bruce, I haven't told you yet, but at Albert Lutuli, where my professor friend works, they did a study as well. Very interesting. Their rate is only 60% deficiency. Now, why do the poorer people have a higher vitamin D than the more affluent people? They walk. They also don't eat the type of foods that we eat. They generally get less of the types of infections and flus and colds and stuff. It's very interesting to realize that. They're getting more sun. Now, what about TB? Obviously there's other influence as well, but vitamin D, when they've done studies, they've shown that you respond quicker if you have vitamin D. And the previous slide, I didn't say it, but it recommends that you must know your dose. Okay, so you need to know the level of vitamin D that you have. And if you get flu, you can actually, if you're low, you can go on to 50,000 units a day for 5 days. And that way boost your vitamin D and you'll recover quickly from your flu. But you all need to check your vitamin Ds and C, because all the types of infections that we get, you can have a better result from if your vitamin D level is normal. Then teeth as well. Teeth is very similar to bone, and dental caries, I didn't know that, but pregnant mothers who are vitamin D deficient, their children have a high incidence of complications when they get it. There's evidence of pediatric asthma, dental problems, and a host of others. So mothers who are going to have children need to make sure that their vitamin D levels are normal too. Adele was telling me of a few other conditions as well. What about depression? A very strong link, without a doubt. Vitamin D, and even in Europe, there's certain places where they have medical grade light boxes on the corners of streets, because it'll be rainy for months on end. And people go in there to get the light. Why is that? They want the serotonin levels to reduce depression. Now, you don't get serotonin when you take vitamin D in with tablets. You're only going to get it from the sun. Okay, early morning, bright light gets your serotonin levels up. If you have problems sleeping, I know Bruce has gone into this in detail. You want to get your early morning walk in bright light. That'll help with your melatonin production as well. So there was many studies done. In fact, there was over 5,000 studies that they looked at, and they only found 13 studies talking about vitamin D that was linked to depression. When they went and looked at it, 31,000 patients in those studies. And people who were depressed had a worse outcome if they were vitamin D deficient. And by adjusting your vitamin D levels, you can help with your mental wellness too. And it's not just depression, it's other mental health diseases. So be happy, make sure you get some sunlight. I want to just go on to, see if we can get past this quickly. Cardiovascular system, hypertension. Most of my patients that come in with joint problems also have hypertension, whether they're old or young. And vitamin D has also been linked to that. So lifestyle can affect your vital organs and your non-vital organs. That's what we talked about. And it's been shown that your hypertension can be better controlled if you correct your vitamin D levels. And we all know that hypertension can affect strokes. We saw that that's the leading. I thought it would be heart attacks. But strokes are one of, Malusi, was it the second or the third leading killer in South Africa? It's the third. Now, if you have a patient with hypertension, the risk of a CVA, cerebral vascular incident, is very high. That's a stroke. Rashes, not everyone gets skin rashes, but some people have conditions of skin, and they get secondary infections. All this is also related to vitamin D, and secondary infections that you get in these rashes can be reduced if you correct your vitamin D. Essentially, all these things come down to your immune system. And there's a few other things as well. Diabetes, you guys covered this morning. Vitamin D is very strongly linked to controlling diabetes and also the incidence of diabetes, both types. And there's various mechanisms for that. But now I want to bring you to focus on one of the things that is very sensitive to all of us. We all know of someone who's passed away with cancer, whether it be close to us or whether it be someone in the work environment. And a week ago, one of my very close friends and colleagues passed away from cancer. 55-year-old, very fit young guy. Okay? None of us are immune to it. He was a famous neurosurgeon. None of us are immune to cancer. And in the past, doctors were saying, stay out of the sun because of skin cancer. But do you know, for every one person that dies from skin cancer, 25 people die from other cancers related to vitamin D deficiency. So we've got to get our priorities straight. You don't have to go in the sun and burn and get skin cancer. You can go into the sun, get vitamin D, and then get out before you burn. But if you can't do that, and many of our Asian populations, there's many certain population groups don't want to get in the sun, must take a vitamin D supplement then. Because with a vitamin D of less than 15, the breast cancer incidence doubles. There are certain cancers that are very strongly linked to vitamin D deficiency. There's a table just showing you various cancers that can be affected. A lot of these cancers, especially in the abdominal area, whether it be ovary or the like, colorectal cancers, because there's a big space in your abdomen, you're not going to feel it. If you have a breast cancer, you sometimes pick up the lump early enough, but in the abdominal cavity, because there's a big space there, you don't pick these things up. They're hidden. And many times they'll present stage 3 or 4 when it's very late and the prognosis is very poor. So if your immune system is very strong, we all have little mutations, and you get a little cell that gets a mutation, and your natural killer cells will come and mop it up. But if your immune system is compromised, and the rate of mopping up these cells in your body slows down, and they manage to multiply, it gets to a critical mass where it's now too big for all your natural killer cells to take care of it. So you want your natural killer cells. My little son, 12-year-old son, calls it special forces, eh? Fruit. He ate fruit this morning, and they chopped up some fruit. He said, Dad, here's my special forces. They're going to kill my cancer cells. You have to have your immune system so strong that it can mop up your cancer cells. And if your vitamin D is low, you're going to struggle to do that. The incidence is really high. And we are actually just scraping the top of the iceberg now. Have you guys noticed in the last 5 years how you hear more and more about it? I don't know if you've noticed, but in the hospitals we're seeing huge amounts of cancers and all kinds of exotic stuff that I never saw in medical school. We are heading into the perfect storm, and we need to do everything in our power to protect our bodies against this. There's very interesting maps and stuff. Prostate cancer, it's not just the ladies. The top parts where the northern hemispheres are, there's a higher incidence of certain cancers because they have less sun over there. We talked about the incidence of breast cancer. The treatment is much better. You respond much quicker if your vitamin D is normal. The tumors often are more aggressive and grow much bigger very quickly if you're vitamin D deficient. So it all comes down to immunity. Vitamin D is just one aspect of your immunity. All the other speakers today spoke to you about things which every single one of them affect your immune system. And that's why this is important. It's not a few crazy people standing up here giving you guys non-scientific information. We are so afraid of what science is predicting that we've taken the time out here to come and share these things with you, and then you have the choice what to do with this. This was my greatest fear. Something a bit personal that I'm going to share with you now. But I operate in Belita on a Wednesday. Now, Bruce and I have to sometimes fight off the general surgeons to wash our hands because we share a wash-up area. And the general surgeon over there is often doing hemicolectomies. That means they take out half of your large bowel, and they do that for cancer. And then this patient gets this bag over here because the food going in has to come out somewhere. All right? I don't know if you've ever seen a colostomy, but I looked at this, and I then looked at what the World Health Organization said about certain meat products being carcinogenic. And I looked at this very carefully and I said, I don't want to end up on this guy's table and walk out with a bag on my side. Now, might be the wrong reason, but that's my reason why I changed. And now I eat a lot healthier because I've seen what it can do to you. So in conclusion, lifestyle factors play a major role in all the systems of your body. But obviously, orthopedics is the most important discipline in medicine. Your joints, your joint health is going to determine how much pain you live with every time you get up out of a chair, every time you get out of bed in the morning, every time you get in and out of a car. Patients will come and say, I was so embarrassed this weekend. I was at my son's 24th and I got up to talk and I couldn't move for a bit. I had to get the hip in gear. It's life, and that is there with you 24/7. Why do you want to do that to yourself? Take everything in your power to make your next 10, 20 years of your life as pain-free as possible. We're heading for the perfect storm in medicine, and you're going to see more and more reports of various health problems and how it's growing and how the government can't keep up with the funds. And I just want you to realize that we can make those choices now to live a better life. Thank you. I think it's quite late. Maybe one or two questions. How much sun to take in per day?
How do you know how long must you be in the sun to have enough sun to take into that?
It depends on a number of factors. It depends on your BMI, which is whether you're thin or larger. It depends on your skin color. Darker skins need up to 3 times more sun to get the same vitamin D levels into their blood. And you need about 50%, is it 15 to 20 minutes a day, 50% body surface. It's quite a lot. So even if you're walking, you're probably not getting enough sun. So it's essential that you get some sun because of the value of sun, and that you also get your vitamin D tested, because you might need to take tablets in addition. Then, a very important point which I forgot to mention is do an 8-week course of vitamin D supplement and get whatever practical sun that you can get. Retest it. A lot of people, because of the absorption problems that we're having with modern diets, that vitamin D is not getting absorbed properly. And you might need a higher dose or an injection to up your vitamin D. So check your levels. Do the things that you can to get your vitamin D level in, and then check it again so that you know where you are and what to do to continue that.
Weightlifting.
Weightlifting.
Doesn't it destroy your joints?
There's weightlifting and there's weightlifting. People who have back problems, if you're doing these type of clean lifts, you're going to have problems with your back. So there are certain things that you can do, and there's certain things that you can't. I think the lower weights, more repetition is better for you. If you're doing very heavy weights, you often, when you're bench pressing that 120 kilograms and it slips like that, you're going to get injury, and that's another cause for arthritis. So what you do, the best thing to do is build it up slowly, and so that you don't get injuries, and just be careful. The only thing you really have to be careful of is bending over and picking up weights, because the fulcrum is very huge. You know, when you're trying to change a tire and you can't get that bolt loose, you just can't do it. You put a pole on, and now it goes easy. That's because of the leverage arm. And the problem with weights where you're picking things up, there's the weak point. Here's a whole long arm of leverage, so the forces going through there are often 60 times more when you're picking up a weight because of the leverage effect. So those are the big things. You've got to keep your back straight when you're doing certain things. That's the main problem with weightlifting. Otherwise, I think weightlifting has got its benefits. Another question? Okay, give us your question.
Hi, is there a specific name for the scan that you said, it had the different colors, green and red and yellow? And who would do that? Would a normal GP do that?
Yeah,
You
they
wait.
can. It's called a BMD. It's a bone mineral density scan. And it's not that expensive, but the GPs can organize that. It's a very routine test, and they normally manage it as well if there is osteopenia. So I think it's very important if ladies after the age of 40 and definitely after the age of 50 should get a bone density scan so you can see where you're at. Do a bone density scan and a vitamin D level. Okay, I think we're going to call that a day.
Dr. De Beer. Hello.
sorry.
Sorry, I've got a total different question. Plantar fasciitis, has that got anything to do with bone, or is it the muscle? What can you do about that?
Okay, now I didn't touch on tendons and ligaments and that type of thing. I gave a lecture yesterday in Cape Town, and some of the people from the UK came and discussed this with me because I highlighted the lifestyle factors with a big problem we're seeing in orthopedics. Have you heard of rotator cuff tears? It's a muscle that controls you. Now there's a muscle on the side of the hip, and most ladies are going to nod now when I tell them. If you press here, you can get tenderness. It comes and goes, but sometimes you wake up at night and you can't lie on this bone because of pain. And the doctor will say it's bursitis, you need a cortisone injection. Okay? The newest science that's come out now is that it's the tendon under the bursa. So just like the joints are starting to fray and break up, we see little fragments when we put a camera in the joint, and we know that cartilage is starting to peel off like dry paint off a wall. The same pathology from lifestyle factors that are causing the heart and brain dysfunction are causing bone and joint dysfunction and tendon dysfunction. Now, that is slightly different. There's certain things that can affect that, like gout and that type of thing. But generally, it's when you get up in the morning and you start walking, you have that tenderness in that area there. Some people have flat feet, and all it needs is an arch support. So it's little tears in the tendon that cause pain and inflammation. And that actually works very well with a little arch support, a heel pad, and maybe a cortisone if it's really, you get these stretching exercises. So that's not entirely the same, but it's close. Okay. Good. I think we're all done for the day. That was a long day. Well done, guys.